chain excellence. Is Dr. Fred in the room? Please, can the organizers look for our two lead presenters and get them in so that we can get started? Okay, I see Dr. Fred. Let's warmly welcome him. Yes, please, come up. Please, can the organizers get us our first presenter, Dr. Kwesi Adai-Donko, so we can get started? Thank you. Please, the organizers were behind time. Can you help us find Dr. Adai-Donko so that we can get started with the first presentation? If he's not yet in the room, probably we will start with the first presentation or dialogue that will be led by Dr. Fred on effective leadership and governance for supply chain excellence. As I mentioned earlier, Dr. Fred is the regional director for Bono East. Oh, okay. Okay, you're welcome. Please, okay. Yes, please, come up. Thank you. Okay, so Dr. Kwesi Adai-Donko will be taking us through the presentation on building resilient and sustainable supply chain for universal health coverage, leadership, innovation, and financing. So please, let's warmly welcome him as he takes us through the first presentation. Then we'll take through a second presentation, and after that, we'll do a few Q&A before we go into the panel discussion.
Good day, colleagues. You even respond. Then I also not talk. Yes. My job is to put the theme of this conference in perspective to enable the various breakaway groups do an in-depth discussion on the subject of building a resilient and sustainable supply chain for universal health coverage, looking at leadership, innovations, and financing. Are you through, Jacob? My presentation will take this form. I'll do a short introduction, then try to juxtapose universal health coverage and supply chain, and then look at leadership and supply chain financing as a pivotal, or as a pivot of supply chain resilience. I hear my time is run out, so I'll skip the steps to consider when funding a resilient supply chain, and then move on to a brief history of supply chain innovations that have taken place in the country. We'll look at the Central Medical Source Fire outbreak and its impact, then narrow it down on characteristics of a resilient supply chain, the prerequisites of a resilient supply chain, and I would draw some conclusions. From all the speakers in the morning, it became clear that a resilient health supply chain refers to the ability of a system. Please, can the lights be, or you are comfortable with it? Okay. The ability of a system, community, or society exposed to hazards to resist, absorb, accommodate, adapt, or transform, including through the preservation and restoration of its essential basic structures and functions through risk management. So if you recall the comment from PPA, Ghana Ministry of Health supply chain system proved resilient at a time that we were caught, pounced down by COVID-19. And the reason was that quickly they were able to respond to the supply chain needs of the country and therefore saved a number of people from dying. Such a system should not be a 9-day wonder, but have the ability to be maintained at a certain rate or level. So you would not say today a supply chain is resilient and tomorrow the system faces disruptions and it collapses. It should be a sustainable, resilient supply chain. Now when we look at universal health coverage and health supply chain. Why? My family people have followed me here. But they will not succeed. Advancing universal health coverage and ensuring health security are increasingly recognized as complementary and interrelated. You would not talk about universal health coverage and forget about supply chain, because supply chain complements whatever is included in the pursuit of the universal health coverage. Access to essential medicines and commodities is vital for good health outcomes, and it is indeed one of the indicators under SDG 3.3b.3 which states as follows: the proportion of health facilities that have a core set of relevant, essential, wow, they are coming, relevant, essential medicines available and affordable on a sustainable basis. In a study by Doherty et al., they highlighted the dire situation in 8 World Health Organization African region member states that they assessed. And they made a case for strengthening medicine supply systems and allocating adequate funding for medicines as critical to advancing and achieving universal health coverage. Initially, supply chain was considered as a clerical activity. So they would call